Hello, everyone, and welcome to today's episode of CAFC Presents. My name is Doug Maynard, and I'm the Associate Director at CAFC, the Canadian Association of Pediatric Health Centers. Today's webinar is titled How Families of Children with Complex Care Needs Participate in Everyday Life, and we have a great presenter in Dr. Roberta Woodgate today. But before we get to that, I want to make sure that everyone is familiar with our webinar process. The webinar will be approximately 60 minutes long. We record the entire webinar. And occasionally, if we have a particularly lively discussion, question and answer period, we may go beyond that 60 minutes. You're free to come and go as you please. This doesn't interrupt the session. And if you do have to leave for any reason, you can always come back to the recording to catch up on any parts that you might have missed. The recording and any other resources that we might be able to share will be posted on the CAFC Knowledge Exchange Network at www.can.cafc.org. And it usually takes me a couple of days to get the information up, and you'll receive an automated message from the system with a direct link to that page. And you can also go to the CAN and use the search function as well. We do take questions throughout the session. You ask questions by typing them into the question box, and we will usually answer them at the end. But I still encourage you to type the questions in as you think of them. That way you won't forget them, and then we'll also know at what point in the presentation the questions are coming in. Today's webinar, in addition to being part of our regular CAFC Presents, is also an opportunity to recognize a number of partnerships that CAFC finds itself in the midst of. First off, I'd like to welcome you to the first MCYRRC Connects webinar, which is a partnership between CAFC and the Manitoba Child and Youth Rehab Research Collaborative, where we are committed to providing 3 to 4 webinars annually as part of the CAFC program to showcase pediatric rehab work that's coming out of Manitoba, with the work of Dr. Roberta Woodgate being the first in this series within the CAFC Presents ongoing webinar series. Formed in 2008, the MCYRRC is a collaborative that brings together clinicians, scientists, and policymakers from multiple fields and professions who have a collective interest in child and youth rehab. Second, it's also my pleasure to recognize Dr. Woodgate as one of the 6 recipients of the CIHR Applied Chairs in Reproductive and Child and Youth Health, with her program titled A Child and Youth-Centered Approach to Applied Health Services and Policy Research. CAFC is one of the official KT partners for the Applied Chairs program with the CIHR Institute of Human Development, Child and Youth Health. So it's our pleasure to recognize that great work that CIHR is also supporting. So now it's my pleasure to introduce Dr. Roberta Woodgate. Dr. Woodgate has developed a strong foundation of research on children's and youth's perspective and experiences of health and illness that has contributed to advancing the improvement of mental health service delivery for Canada's children and youth. The main goal of Dr. Woodgate's research program is to conduct applied child and youth health services and policy research that involves and is germane to health services managers, policymakers, and healthcare providers, as well as children and youth who are directly impacted by the research. So that certainly fits right in the wheelhouse of CAFC's audience for sure. As we certainly can tell by the fairly quite large audience, we have well over 200 organizations signed on to this webinar, an international audience as well. So it's my pleasure to hand the virtual podium over to you, Dr. Roberta Woodgate.
Well, thank you, Doug, and I really like to thank CAFC for giving us this opportunity to present this work that's really important to me and my research team. I'm going to be presenting on a study, and I'll just let you know who the research team, in addition to myself, Dr. Gina Rempo, Dr. Jackie Rippart, Barb Borton, and Dr. Marie Edwards. So I want to thank them for all their hard work on this study. I also want to thank Children's Rehab Center for their partnering with us on this study. So again, this is an honor today, and I hope we'll have lots of discussion at the end of this session. So please type in your questions. Okay. We're just having a little bit of trouble with the slides. Okay. Okay. So this study. Okay. So as you know, over the years, with the advances in disease management care, we have children who are living longer, children who have with conditions who normally would not survive are living with disabilities and complex care needs. At the same time that this has happened, we have had also a change of care from care within institutions to care at home. And of course, this is a good thing, again, because we have the child is in the home where it's the most important place for the child to grow and thrive. At the same time, too, there's been a lot of stress with this increased care at home, and for some families, it's been described as living in a house of cards, where you don't know one day from the next day how things are going to transpire. I'm just going to, and just if you can just take look at this quote, that this was from our study. Yeah, so this dad had said, he would have been farmed out to some hospital somewhere. He'd be lying in a vegetative state, somewhere ignored. He would have been feeling guilty about what happened to our eldest child. If we had farmed him out, we might have had a third child, and we would have been that sort of distant figure existing in a vegetative state somewhere. So without the money, he would have had no life at all. So this really shows the importance of having children in their home. But at the same time, with increased caregiving demands and the stressors, it has been described as overwhelming at times for families. And there has been research done in this area, but one of the areas that is lacking is how families participate in everyday life, families with children with complex care needs or with children with disabilities. There has been work done on participation, but more so work from looking at factors that contribute to how families participate, and also looking at measurement tools for participation. But there's very little work done on how families, from their own perspective, view participation. And why is that important, participation? Well, we know people who participate in everyday life, that contributes to a higher quality of life. And hopefully, families of children with complex care needs are able to participate. So we decided to undertake this study. It was a longitudinal study, and what we wanted to look at was to extend our understanding of how the changing geographies of care influence the way that Canadian families with children with complex care needs participate in everyday life. And when I mean changing geographies of care, I refer to the changes in healthcare service delivery that are the result of the transfer of care from formal spaces such as hospitals to informal settings such as home. So again, we want to look at that impact. This study was guided by therapeutic landscapes, and this framework refers to the changing situations, local settings, and milieus that are not healing places, but those landscapes associated with the maintenance of health and well-being. Basically, what this framework refers to is refers to landscapes or places considered important, and those landscapes that provide individuals in many ways a sense of security and sense of belonging. We want to know how these therapeutic landscapes provided a unique way for families to interact in the varied landscapes. For this study, families were recruited from the primary integrated health and social service community agency in Winnipeg. Children under the care of this agency include those with complex care needs and disabilities, and often require some form of technological support. We recruited families through purposive and also snowball sampling techniques. In total, we had 68 parents participate. That was 39 mothers and 29 fathers, and that was from 40 families. And again, this is one study where I had more fathers participate than normal, and I think that speaks to the complexity of the care that these children receive. The fathers were present, and so again, to have 29 fathers in the study was quite amazing. So the families, one family had 2 children with complex care needs for a total of 41 children. In addition to the child with the complex care needs, 30 of the families had at least one other child. The age range of the children was anywhere from 6 months to 26 years, and with a mean age of 10 years. And we, when we looked at what type of children we would have involved in the study, we didn't exclude anyone. So we had children with behavioral, physical, cognitive, and sensory and emotional disabilities. Some of the children had more than one type of disabilities. The primary diagnosis for the children in the study was cerebral palsy. 9 out of the 41 children had cerebral palsy, but we also had children with developmental disorders, seizure disorders, terminal cancer, chronic lung disease, genetic disorders, and also congenital disorders. And the majority of children in the study had to have had used some form of technology device. The study was qualitative, and it was longitudinal, so it occurred over 3 to 4 years. The goal was with these families to collect data at 3 points at a time, and we used multiple methods of data collection, interviews, and we interviewed the parents. We also, when possible, interviewed the children and also siblings. In total, 12 children were involved in the interviews and 13 siblings. We also had, when we interviewed the parents for the first time, we had them do an eco map. And an eco map is a graphic portrayal of social relationships and networks between individuals and families and places and settings. So we were able to have them draw who's in their lives, what places do they participate in, and also have them draw lines between these varied places. And the lines would indicate the degree of how strong that relationship was, or if it was a weak relationship. We also had families do photovoice. After the first interview, we gave families cameras and we said, go out into your world and take pictures that represent what it's like to participate in everyday life. We gave them a period of 3 to 4 weeks to do that, and then we interviewed them again after that, and then also subsequently interviewed them 6 months after that fact. And for the analysis, it was true to the ethnography method, and it involved several layers of analysis to arrive at key themes. The 4 themes that emerged from the study were meaningful participation, having a life, the value of participation, harnessing resources in the changing geographies of cares, and that's conditions affecting meaningful participation. And then finally, participation is something less, quality and quantity of meaningful participation. And I'm going to go over all those themes. So we'll start with the first one. So meaningful participation. What did that mean to families? For the families, the shared essential essence of participation as perceived by the families was that it was equated with a sense of being a part of something or being involved in something. It wasn't so much about doing, but it was about being, just being involved. And as this one mother had said in this quote representing meaningful participation, being involved, you know, being part of something, being a part of a group, you know, whether it's Boy Scouts or a service group or, you know, volunteering for something. Another mother had said, and I think this quote represents too, I mean, the child did not have to be doing something, just had to be there. So this mother with this child had said, you know, if the girls are involved in something and we can at least take M, the daughter with the complex care needs, there to hear, and just hearing a crowd to listen to, but M being able to be in situations like where she's hearing what's going on. I think that participation, being able to take her to public park where my other children can go skating, and I sit where it's warm, but she'll sit out with us. So as long as she's around what is going on, I think that's what I consider participation. So again, it wasn't that doing it. It was more like being there with the family and being in that situation. So you could be in the, families could be at an event or be somewhere, and it doesn't mean that the participation was meaningful. To have meaningful participation, there was a number of attributes that parents had identified. The first one was involving some choice. Secondly, feeling safe, or that having that element of safety. Third, understanding and acceptance. And fourth, accessibility, and then accommodation. Now, for safety, it was really important for these parents to feel that the child was physically and emotionally safe, a place where they can trust. So here, as one mother had said, I think there's a lot of choice for activity, and where it's an environment where you feel comfortable, that things are organized, and that people who are involved in the activity or directing the activity are qualified. So that whole notion of feeling, comfortable and safe and having that trust. At the same time, it was important to have choice. And I really like this quote from this mother because she was talking about her daughter where, yes, safety was important, but there had to be some element of choice. Now, her daughter had a tracheostomy, was a teenager, so this mom had said, I would say that for us, participation means it is something we want to do. We are going to go and do it. Like I take responsibility if something happens. She, referring to her child with the complex care needs, taught herself to swim. And we got in trouble for it a few times for the doctor because she has a tracheostomy, and she shouldn't be in the water, but she sticks her finger in her trach, just immerses herself completely under the water and swims. This mother had many stories of what some of the things that her daughter did. Yes, the choice was important, and it was important to have safety as well, but again, that choice and sometimes taking a little bit of risk. So acceptance. This is one attribute that was probably one of the most important attributes that parents talked about. And that was about having that, having others accept their child, getting their child, and also getting who their family was. So this one mother said, you have to make sure that people are very understanding. You just have to make sure people understand who Jay is or they're forgiving for his behavior. Because you're always going to have something that might go wrong. Because you're always preparing. You're always thinking like that in front of your head, thinking it is there. You are just like, okay, something might happen. You could be out there in the public and he might have a meltdown. So we have to remove him from it. So having that acceptance, and also the families will always be thinking ahead, well, if there wasn't that acceptance or if there was some problem, having that, place where they can just have this exit place to go to. Because again, just to ensure that the child is not hurt physically or mentally. And this is just some pictures of some of the children participating, and from the photovoice. Sorry, I'm just waiting for for the slide to change. Accessibility. So again, it was really important to have this meaningful participation so that the places were accessible, that they could get in and out easily. So this one mother said, just like the accessibility thing. So many times we go places and they'll say they have their wheelchair accessible, but they're not, or they'll only be partially wheelchair accessible. Like when we went bowling, the LA said, oh yeah, they were fully wheelchair accessible. Yeah, could we get in there? But we could get in there, but you had to walk up the steps to get to the bowling line. So it's like this. We were this close. So quite often families would describe these experiences where it was just almost pseudo accessibility, where it was just partially accessible. They may get into the building, but then they can't get into the elevator because it's too small or whatever. So again, there was always something missing. Another mother had said, I guess that's the challenge, is transportation for him. Or in the sense we had purchased a van, but they are not able to put a lift in it. And we have this portable ramp. It's very expensive to modify the van. Plus the portable ramp, we were able to get a lighter one, but it's not really very light. For me, it's harder to be on my own. It's really hard to do it. And the lift, you just have to be much easier, to take him. And so it's just that you limit your trips. So again, all that, that something's missing. And families took lots of pictures. It's just one example of, things like inaccessible parking or trouble getting in with parking, and transportation was a big issue. And here's another picture seeing where we have this lift and making things accessible, but as this family had said, quite often to park, there wouldn't be enough space for that lift to be, to be able to use that lift. And again, here's another where it's so hard to get in and out of the cars because of the tight parking space. Accommodation. Well, when things weren't accessible, it was really important that, people would be flexible and accommodate for them. And this one dad talked about a school where his son had gone to where he was getting a little bit older, and the school accommodated them by making this room, it was like a hospital room where the child could go in and have a sleep in the afternoon, and everything was accessible for him. So the dad had said, There's this new room actually the school had finished. It had just finished it last year before he started school. And it's all set up. It has a track system in it, a washer, dryer, a tub, a roller, a roller and shower, an accessible toilet, accessible sink, and there's a change table where it goes up and down. And they also managed to fit a hospital bed in there for him, because next year with long days we don't know how he's going to handle it. So they have a bed for nap time. So for his days are going to be longer of the next coming years. Yes, he's the first severe special needs. For this father, it was really important that they did this for him. The child was able to go to school, but it also meant for this father that this room would be available for other children down the road. And this is just one of the photos that the dad took of the room that in the school. So having those attributes were really important to have meaningful participation. But what did being able to participate mean for these families? Basically, it meant having a life, and that was the value of participation. So having a life referred to being engaged or involved in a place where families feel that they belong, are accepted, and are able to contribute to the landscape that they participate in. By engaging in meaningful participation, an enhanced sense of well-being was possible to achieve. Parents reinforced that meaningful participation had restorative qualities. And again, the family stressed participation was really important for that child with the complex care needs, for their development. And by participating in their daily life, that means that they would be even better in the future because of their development. It was important for their sense of self, sense of place, and sense of reciprocity, and not only for the child, but for their family. So here's just to give you an idea of why participation was so important for these families. Like for her, I guess when I'm relating it to her, it's like mastering, being able in that situation, like going to church and feeling confident. She just go up and grab a flag and go with the other kids. Like she mastered it, being on her own there. So again, that was one of the examples to show how it really was important for their development and also for the participation. Another dad had said, mother I should say, said, this year my son went from elementary school to junior high school. So this is a brand new school for him. And his classroom teacher had been telling me that there is a group of kids sort of headed by one of the cool kids in the class. One of the cool kids who would be considered, I suppose, by his peers cool. He didn't know M, but he went to a different school for elementary. But apparently he had taken a real interest in M, and he had grown quite fond of him. And he will spend time with him in the classroom and read to him and that sort of thing. And that sets the tone because he's one of the classroom's leader in what the teacher had said to me. And that set the tones for others. So again, by having her child in the classroom, and this was so important, gave him a sense of belonging. And again, it shows the value of participation. And here's another example. Both this mom and dad were talking about how their child would be dancing, and they had to participate in this dance at another school, and they were just sharing what are the differences between the two schools. So the mom said, "Oh, that was that dancing thing, the dance thing," and Em was participating in his wheelchair. Yeah, they were doing that. They went to X school to present at a dance thing, and the kids in the wheelchair were participating too. And they said the kids in the other school, because it's not a cluster school, were not kind of like getting it. And they would say, "Oh, like really?" So, yeah, but that was cool that the story we heard from the teacher, that some of the kids at our son's school who knew M raised with him, they said he knows that the other kids at the other school were staring at M. And we don't do that. We understand them. And they sort of, I can't remember the exact words he heard, but it was to the effect that the kids at my son's schools came to understanding that they had learned something that the other kids were not learning. And I thought, wow, one of those warm, fuzzy things, and maybe this is real. So again, this reinforces the importance of participation of the child and also for the parents. And then this whole notion about participating for developing for their child and for the sense of self, but also it was important to participate to give back to the community. So this one father said, "Well, I guess it means that we are contributing to the community as well as being supported by it. We need more support from our community than most people do. But we also feel that even if we didn't need more support, as citizen has an obligation to his or her community to participate in it. to give to it as much as possible. And we feel very strong that it is important to have both the confidence that your community is standing behind you and that you are able to make a contribution to the community and stand behind your neighbors. So again, it was really important. Parents believe that children with complex care needs need to contribute to society in that they taught others to be caring and empathetic and help others in their development. But it was also important for the families to participate, to give back. So families really value meaningful participation and the importance of participating because it contributed to them having a life. But saying that is being able to participate is one thing, and was to be able to participate. It was really parents had to harness resources in the changing geographies of care. And this refers to the decision to choose to participate was contingent upon the availability of resources and the parents' ability to harness them within the changing landscapes of care. Harnessing resources refer to the work parents must do to access the necessary resources that made it possible for them and their children to have a life. So even though they wanted to participate, it was not so easy to participate. It involved a lot of work. In order to participate, parents had to harness resources, and they had to become experts about their child's unique changing needs, but also they needed to become experts of the complex and dynamic social health and education landscapes. So as this one mother said, it involved a lot of work for these parents. So this one mother said, we'd love to take him to Tinkertown just to ride on the train and go on the merry-go-round and have some cotton candy. But you know, it's such a chore to try to figure out how we'll work with it, with Kay, and with Kay's feeding schedule, and with Kay is going to be will Kay be in a good mood? And you know, it's hard to get that energy, and it all sounds so wimpy, but it's true. Like some days we're just coping, you know, we're just coping, lack of sleep and lack of stress. So again, although these families wanted to participate, it involved so much work that it was not always possible. And it also involved having various resources, a number of resources, but what was really important was suitable transportation, respite, financial support, assistive devices, and support from families and friends. And for these families too, it also involved a number of interplay of elements within the landscapes that included individual or personal resources, social resources, physical, institutional, and economic elements. For example, they may have one of the resources, but something else may be missing. And here's an example. One of the dads said, I think the community as a whole has accessibility issues. Public parking is a real problem for people with disabilities because we're going increasingly into parking structures that have inadequate overhead clearance for any type of wheelchair van. They got a whole row of wheelchair spots in the parking structure, but nobody who has to have a raised roof can get into them. So again, there's an example of something always missing. They have this van, but then the parking structure isn't appropriate. Again, when the landscapes, the parents' ability to become experts was shaped by the landscapes they interacted in, and whether or not the landscapes fostered parents' ability to care for their children. When the landscapes were less accepting and helpful, parents were less able to harness resources. Moreover, experiencing barriers to services created distinctly non-therapeutic landscapes for parents. The physical, mental, psychological, and spiritual resources of parents were crucial determinants of the family's ability to harness resources. Another example of how there was something missing. We can't take him to any outdoor activities because we can't rely on pathways and sidewalks to be passable via wheelchairs. We can't take him to the nature retreat, for example. We can't move him around easily. Even with the wheelchair van, we can't easily get him from where we would have to park the place, and it's very difficult, physically demanding, to push him across the landscape. It's impassable. And just so you know, Winnipeg this year has had an enormous amount of snow, and just for able-bodied to walk out, it's impossible. And I think these families must be totally housebound right now with the way the roads are and sidewalks are taken care of. And so, just an example, even if they have the wheelchair, they have the fancy equipment, they can't use it. And again, we want to reinforce the families in these studies, parents, how much work involved, the mental, physical, psychological, and spiritual. And again, they were crucial determinants of the family's abilities to harness resources. These families had to assume a number of roles, not only the caregiver role, but the educator, because they had to teach others, They had to be the advocate, really stand up for their child. These families, in the course of interviewing them, would tell us how they became this advocate. They had to be the fighter, fighting the battles, the professional caregiver with special knowledge. The student, they were always learning about their child, what their child needs, and learning the various systems. Then they have to figure it out. They were the detective, always figuring out if they, not knowing what to ask sometimes was also a problem. And they could be the smartest parent under the sun, but if you haven't experienced something new, if you don't know what that experience is like, you're not going to know what questions to ask. The constant coordinating and planning, like to get from A to B, it always involved this planning. And then also watching over and protecting the garden. So again, these families assume multiple roles. And these are just examples of some of the work that the equipment that families used and the work that it was involved, that parents took pictures of. And through the course of the study, these are just some of the quotes that came out in multiple in the interviews. Get the ball rolling, get the ball moving, the battle, 24/7 care. I remember feeling just like I was in jail. Other than mayhem, our lives are pretty chaotic, jumping through the hoops. A lot more going on things. Red tape. So again, multiple throughout. These were frequent quotes that parents would use in the interviews. And I have to say, too, the parents in our study, even parents who care for children for many years, the lack of sleep that these parents experience, I'm really, really amazed. Not only the health and social needs for many of the parents were not being met, but amazing how families are able to cope. And sometimes, and it didn't really matter on the type of complex care needs or disability. You could have a child who required a lot of physical care, so that was very physically demanding. But at least the care was the parents knew what to expect on a day-to-day basis. Whereas the child with maybe the behavioral issues, it was not as predictable. So that made it very tiring for parents. So again, it wasn't so much a type of disability. So that parents, that one was more the disability, one was more harder to care for. They all had different problems associated. So considering parents had to harness these resources and involved a lot of work, so what was the experience of participation like? Well, for their parents, the theme that came out was participation is something less, and that meant quality and quantity. That was the quality and quantity of meaningful participation. So it varied among families, but in the end, some families got more participation, were able to participate more, while others struggled to participate. The intense planning also resulted in a lack of, the spontaneous, let's just go do this. There was no really spontaneous, participation wasn't spontaneous. Another thing that some of these families had was for some families, the only landscape that they were able to really participate where they gave them a sense of belonging or sense of place was their home. And overall, I would say for all families, even those who were able to participate, it was described by the parents as something less that they would have wanted or desired for themselves and their children. So just an example of eco maps that families have drawn. So one family, for their eco map, they just had one circle, and that was the landscape, and that was their home where they participated in. And then another example where the family had more places to participate in. You can see the work, and work, the line is thicker, so that means a tighter relationship, extended family. And so this family was able to interact in more than one landscape. So here's an example as participation is something less. So this one mother said, I know at one point we like to take the kids to Disney World, but I don't know if we'll be able to go with Kay, that's the child with complex care needs. I don't know if it's going to be my husband C, the other child, going on the trip, and that's very upsetting for me. Again, from some of the families, the way they would participate would be where the mother and the child with complex care needs would perhaps stay at home, and the other children would go to their family dinner for Thanksgiving and so on. So you almost had two families in one family. Interacting, and that would be the way that they could survive. And then again, here's an example where you couldn't do anything spontaneous. So this mother said, It's long-term planning. You just can't on the spur of the moment say, you know, we're going to do tonight, we're going to the football game tonight. It doesn't. Our life doesn't work like that. So nothing was spontaneous. And then another mother said, who felt she had no life, I have no life. I used to volunteer with Big Sisters, and yeah, we did the church stuff. Yeah, everything has stopped. My life revolves around M. That's the child with complex care needs, and what has to be done with him. I had my life before. I'll have it later on in the future. So overall, what these families had said to us, and I would say that participation was described as a dynamic and reciprocal social process. It was process of involvement with being with others, not so much with doing. It was very participation, many factors affect participation, and it's a very complex concept. It's not simply an event or a mission. The attributes of participation were viewed by parents as essential to securing a sense of trust in the landscape where participation occurred. And participation was valued by parents for what resulted by participation. Again, it gave their child a chance to grow, it gave their family a chance to grow, gave them a sense of belonging. But again, not participation for the most part for these families was viewed as something less. It was too much work involved to be able to participate to the full, for their full potential that they wanted to. And again, parents to have meaningful participation struggle to ensure, parents struggle to ensure that their child would have a life. It was really important. Also, but for participation, parents have to learn how to negotiate participation for them and their children in landscapes where barriers still exist. And I think of all the barriers, the social and attitudinal barrier still remain one of the biggest roadblocks for them and their children. And having a life was more difficult to achieve in those families in which parents have trouble harnessing the resources that made participation possible. So I hope we'll have some discussion on this, on what is needed. So looking at the society's responsibility, the work of society, and leadership and policy. Hall believes that society needs to seize back the agenda and focus on social structures and places of well-being and empowerment. LeBon contends that the disadvantage experienced by families of children with complex care needs are seen to lie in the exclusion rather than excluding structures, for which the solution is targeted at remedial exclusion rather than more systematic reform of economic and social inequalities. LeBron reinforces that the focus should include the social economic values and governments that create exclusion, as opposed to a focus solely on focusing on groups and conditions excluded. So again, it's really getting at the values of and looking at policy. I think one of the Peter and all reinforced that problems with home care policy are of great ethical importance. Public policy is a moral endeavor, and I think public policy choices make statements about who we are as society. I think there's currently a disconnection between Canadians' core values and the realities of many lives of Canadians. The entitlements to rights and justice of Canadians should ensure that children and their families are offered adequate and special home care services. So I think what I like to end, and hopefully we'll have some discussion on this, as parents of children with complex care needs harness resources in the changing geographies of care, it is clear that they do so with a commitment to their family and their children's human potential. Their efforts benefit society by broadening our collective human experience. But yet, I think the question remains, will society be there to assist the growing numbers of families of children with complex care needs as they struggle to have a life? And I like to open up discussion, but I just want to show some pictures of some of the children who were able to participate in having a life. And this was one children going on a Halloween. And here's a mother and son going down the street on their bicycle. Classroom where you have children participating, and children here playing, and being involved in sports. So some of the children, and again, one family who was able to go to Disney World. And again, this family who was able to go on a camping trip for a shortened time, although they would like to go longer, but they were able to go on a camping trip. So I'd like to have some discussion now. I have a question for someone in the room today. They want to know about the interviews. How did we arrive at the answers? How did we prompt? It was a very open-ended technique, so we avoided leading questions and so on. So we would ask open-ended questions and probe from there from what parents had said. It's not to be leading. So.
Doug, it's Elaine. If I can ask a question?
Yeah.
Yes, Elaine.
Roberta, first of all, thank you for an outstanding presentation. Fact as well as passion is so clear, and really, really appreciate that. The last few slides, you've talked about the need for leadership through policy development, work of society, societal responsibilities, and of course the ethical importance of home care policy. My question, you've presented strong evidence of the difference that having resources make, and having access to those resources, and the impact on the whole quality of life for the entire family through sort of a child and youth centered approach. Can you speak to your next steps or recommendations for how we can bring this to that policy arena? To how can we take it from the research to practice and policy? Is there a plan, Roberta? I see that as being so important.
Yes.
Can you speak to that?
I mean, I agree with you, Elaine, 100%. And we are at least in Winnipeg, we're trying to get together with Children's Rehab, with some of the people in Regional Health Authority, what we can do to make a difference. And we've been sitting around the table, people from rehab, really how can we make their lives better? And it is a difficult situation, and there's no easy solution. And how can we provide more resources for families? I had a conversation recently with one of my colleagues who's in law at the University of Manitoba, and we're thinking, what can we do? What could be the next step? I don't know if this is even going to work out or be possible. Is there some way that we can pay families so that they can use their funds to where they want to use their resources? Like, they should be given some type of salary, because they are doing work that normally us professionals would be doing. Now, where can we get that money? That's another whole situation. But I mean, there was a study done in Dauphin, I think it was Dauphin, Manitoba, for people who were on welfare, where they were given money and they were able to spend it appropriately. It worked out really well, but it was a program, and that program is no longer in existence. And I think it was only run for a year. But this is one of the areas we're thinking, if we can somehow do some type of intervention where we could do this with families. Again, it's something we're thinking about. But yes, I want to take this to the next step where we can somehow do something that will make their lives better.
Exactly. And that's, from when you think about, I see that as being such an important part of knowledge translation, and how do you take this evidence to actually make the difference? Roberta, I'm fairly certain you're aware that, and this is for all of our colleagues online today, CAFC is working with many, in fact, many of you are probably online with us, in a complex care community of practice, where the goal is to develop national guidelines or recommended standards of care, and perhaps offline or on another teleconference, we can look at how that work might actually support the translation of some of your recommendations. So I just wanted to mention that.
That would be really helpful. And I do agree, we need these standards of care. And again, my concern is too, we have these standards of care. Will government support these standards of care? the fact that, again, this families in our study, parents aren't getting sleep, and it's,
Yeah. Yeah.
it's,
Can you hear me here? I think it's very individual.
Yeah.
Families need the ability to manage their own care.
One of the colleagues, Barb Arrington, around the table, I just said she feels it's from her experience, many years working with these families, feels it's very individual thing on what families need. So that's why I think, again, I don't think we can say this is what, one glove fits all, so to speak. And that's why, again, potential for families having additional resources and funds where they can decide, it's more appropriate, I want to get the lift in the van or whatever, what's really important to them.
Right.
All right, well, we do have a number of other questions that have started coming in from the audience. The first one comes from Deb, and she's asking, do you have a home care program for children in Winnipeg? And I think Deb means a regional or a provincial program. I know Deb's part of the Alberta Health Services Home Care Children's Services program. So I'm wondering if there's something similar at the regional or provincial level in Winnipeg.
Yes, we have a home care program, and actually we have one of the best home care programs across the country. I know that only from my years when I used to be a clinician. Families would come from Ontario, whatever, they could not get over some of the services that families are being given. Not to say that things are lacking, but not lacking. But yes, we do have a home care program.
The next question comes from Jen, and she's asking, do you have any comment on families feeling participation is just being there versus being actively involved? You did mention that with one of the mothers mentioned that even just being there was enough for her particular child, but just wondering if you could comment further on that.
By what I mean is, just being there. Now, it doesn't mean they weren't involved doing activities, and they had to have choice of the type of activities, but it's that feeling of being in that group, that sense of belonging. So doing was important, but just being there was very important.
The next question is, given the current political reality of constrained budgets, how can we advocate effectively in the political arena in this area?
Oh, that's I just completed a study looking at First Nations children, so families with disabilities. I've gone up to Norway House, one of our communities, very similar findings, except all the other things that First Nation peoples are experiencing on top of that. But I often think, gee, if we could get all these groups together, the children, elderly people, like get them, it would be such a powerful group, and have them go and really do the lobbying with the government. I think of the MS individuals, MS, and the whole issue with that that treatment. I think, like I say, get everyone together, and the strength is in numbers.
All right.
And one of my colleagues did say, though, and that's so true, it's very hard when these families are sleep deprived, and that's so true. It's sort of like families just manage on day to day, and you don't have that energy to take on one more thing.
Michelle is asking, can you name some of the specific participation measurement tools that you mentioned at the beginning?
I don't have a list right now. Some of my colleagues around the table may know. No. If Michelle, if you want to email me, I can give you the list. I'll give you some tools then.
All right. Yeah, we can certainly do that, and I think Dr. Woodgate's contact information is on the page on the Knowledge Exchange Network, so you can always get in touch with her there. Krista is saying thank you and terrific study. She's saying you mentioned both social isolation, especially in winter, and sleep deprivation as challenges described by the participants. She's wondering of what you found about low mood depression in your findings.
I didn't study depression per se, but there were definitely some parents in our study who said they had depression, or when we go interview them, you could tell that they were having some problems, but some of the parents had experienced depression, very much so. And usually it would be, there'd be one parent and the other parent would be there to, try to help that person with the care. But definitely there were parents with depression in our study.
All right. Nancy's saying that as a nurse with 30 years plus experience in neuro, she calls it, and having seen many of these kids move from institutions to home, she says everything your parents have reported sounds familiar. She agrees that they have a moral imperative to change social policy and develop humane home care services and community supports, but she sadly is not optimistic.
Yeah. I sometimes feel like that too, because I think everyone who's listening probably knows this work and knows this, has lived this. People who are around the table here know this, and we see this, and I think part of it is too, perhaps it's part of us as a community. We have to all take responsibility as well. You know, on your street, if there's somebody with a disability or complex care, maybe we need to also like do something, like help them with their groceries or whatever. But I mean, that's just one aspect. But yes, it can be very depressing. You think about this all the years and you see things. It's interesting too for people who don't have a child with a complex care need or a family member. I don't think they really know the extent to what these families go through, and that's another thing that we need to, make the public aware of this. I'm making from these findings a video about this with families involved that we hope to use and share with people. But I think the public needs to be known what families experience. And I think these families are basically saving the system when it comes to funds. They really are saving the system. So, like, some of those funds that are saved should be put back to these families.
Mary's asking: have parents identified what they need to continue in their role as caregiver, as the primary caregivers? Were they specific about anything that they would like to have, or?
Yes, better respite. Better transportation, financing, more financial help, support. So yes, and it's not like they're asking for everything all at once. Just day by day, just the little things too make a difference as well. I think the things that they ask for, probably everyone around in the room or listening know these things.
Keiko says, great presentation and thank you. She would like to hear from you if parents have mentioned policies and government supports as part of the resources they would use or would know of to facilitate their child's participation. And what would be the systems to facilitate that? As she says, as I've finished typing, she's heard Elaine's question, which was sort of similar, she thought, but she'd like to hear what families think about existing and missing policies or systems.
Well, it's interesting. We have a family advisory committee from this study, and so one of the meetings that we had, and the families around in this advisory committee have they're very knowledgeable. The children are older. They really know. They could teach everybody. But it was interesting that when we had our first meeting, they were also sharing things with each other that they didn't know about. So again, these policies, it's not families don't know about everything, and so part of the reason is they don't know what's out there, so you don't know what questions to ask. So I think there's that whole issue about knowledge and informing families that, like, yes, you can get free diapers or certain things. Like, again, and so we're failing, I think, as clinicians, that we are not telling families, okay, when your child is 6 years old, when your child is about to go to school, you have to plan a lot sooner than you would for your child without the special needs. You have to know what school has the special supports for your child. So again, it's having that book of knowledge out there, or maybe making it as making some type of application, like something web-based, where families can click in and say, this is what I'm having this problem. Where do I go to get help? So the policy piece, I don't know if I answered your question, but families would talk about they wouldn't frame it as policies, but they would talk about, well, yeah, we know we can get this covered through income tax or something. But even the most seasoned parents who were very knowledgeable did not know it all. And that's from our fault, not giving this information. Did I answer your question?
Oh, I think so. I'm sure you did. But Keiko, if you do have any follow-up comments, please don't hesitate to type them in. The next question from Michelle is saying Winnipeg has integrated health and social services, but they don't have this in rural Manitoba. Do you have any thoughts or comments or knowledge of how this might be addressed in the future?
Yes, and you're so right about rural, and the communities, the First Nation communities, and like again, the study that I've done with First Nations families of children with disabilities up on the reserves, the families even get less because of the disputes between the two levels of governments. Children who don't have physio, or who don't have speech therapy, maybe they see the speech therapist maybe once a year. Well, that's not going to help you very much if you only get to be seen once a year. Yeah, that's another difficult, complex, not problem, but challenge. How do we solve it? I mean, Canada is such a vast land, and it's like, how do we get these services to families, which is really lacking. I don't think I have the answer.
Yeah, definitely lots more questions than answers, I think, with some of this, for sure. Did the parents report any instances where they benefited from support of professionals like therapists or social workers to reduce the stressors or improve their participation?
And that's very key, and it's a key in all my studies. It's those relationships and how the social worker, professional, occupational therapist, how they relate to them. And it's really important that they have that trust and bond. And when they do, the families do talk about the good professional when there's that trust, and when that person really understands them and accepts them and really is listening to them. And some of us do it better than others.
And Keiko did type in that, yes, that was a great answer for her question and good validation for what they're working on with projects and developing apps and other web-based resources to better inform parents of children with disabilities. So, so she says she's going to follow up with you.
Oh, good, wonderful. I'm wanting to do something in that area, so that would be wonderful.
Do you have any strategies to encourage participation of those families who are hesitant about taking their child with complex needs into the community, like on their own for the first time rather than with hospital staff or those sorts of supported situations?
Yeah, and that's a very good question. There are some families, because they just don't have that trust, they don't feel secure, they don't want to risk taking their child out, or risk themselves on going out, because you don't want to be hurt. Some of the families talked about, to this day, going on the bus with their child, they can't do it, or it's very difficult because they still get those stares, people staring at their child. Some people are able to deal with the stares, but so yeah, I think for those families who who really are afraid to go out, I think you have to do it slowly, and have somebody there who's a support person who can really, where they built that trust, and then from there, hopefully, will help them to go to those places. And it's also having the place where they want to go, ensuring that the people there understand and know and get their child. So again, I think it's really being able to build this trusting environment for them.
So Lisa's saying, again, thanks for the presentation. She's not sure if this was explored, but can you comment on the value of respite for the families, their attitudes towards respite care, and what types of respite the families find most useful?
Respite has, there's good and bad views about it in the study. For some families, it's really hard to have that person come into your home who's a stranger. Some families just cannot deal with that. Respite, it's one of the problems is not getting it when you really need it, needing it more spontaneously. So I would say, yes, more respite is needed, but respite where the families feel comfortable and can trust. But that's also that issue. They need the respite, but the issue of also feeling comfortable having that stranger in your home.
Can you, Preeti is asking what the name of the home care program is in Winnipeg. Does it have a formal name?
Integrated Children's Services.
Children's Services, all right. She's also asking about the program in Alberta, and I believe it's called the Alberta Health Services Home Care Children. Alberta Health Services Home Care Children's Services, I think, is the name of the one in Alberta, but I'm not.
And I think in Winnipeg it became integrated, I think, about 8 years. eight years ago.
Yeah.
And the clients have specially trained nurse coordinators.
In fact, I think we did one of our first webinars a few years ago was on the ICS. I believe Maria Stevens presented with us on that webinar.
And the new children's, we're getting a new children's rehab built, which took a long time to find a spot in Winnipeg, but it's going to be, all the services are going to be integrated in this building as well. Sky.
All right, so the next question from Bruno is, he's saying this was a great presentation and thank you. He says, the evidence that you presented points to the importance of planning, at least from what he understood. Has there been any work done in evaluating different tools that would help parents to plan and coordinate life and care? For example, providing health education or subsidizing iPad or iPad apps or anything like that?
And no, there hasn't, but that's something I'm very interested in doing. Like I said, I'd like to develop some type of app that would be, that would help families plan, because there is so much, it's unbelievable the amount of work in planning.
There are a number of questions again about how, and we may have these may have come in after we it's more or less answered this question earlier, but there's still some questions about this where people are asking, did you receive, again, any specific feedback from the parents in terms of what they might need specifically to help them build capacity, like the capacity to be sort of more participatory and engaged in their communities? I think people are sort of looking for those specific things that they can do for families. Do you have any further comment on that?
It really varied on the family and what the needs are. So very individualized, but again, things like more respite, and transportation is, because we had lots of photos of vans and stuff. Transportation is a big issue, a real big issue. Having some sleep, just getting some sleep. So again, it really varied on each family situation.
And you also sort of touched on this as well in the question earlier about services in rural Manitoba. But Paul is asking, is there a difference between home care services provided in First Nations versus the communities versus the rest of the province?
Definitely. And again, First Nations, it's a unique situation because of the disputes between the two, the federal and provincial government. You have, and who's going to be paying for these services? These children aren't getting the services, plain and simple as that. About Jordan's principle was created, I think 8 years ago. This was a little boy on Norway House, from Norway House Cree Nation, who was born with multiple congenital disabilities, was in the hospital, and the families wanted to take him home. And so the healthcare providers also agreed. They came to this agreement. But unfortunately, Jordan never got home because the governments were arguing who's going to pay for his care, and he died in the hospital. So since then, there's been this movement to do something about this. But they created this principle, but no government has really done anything further to make this principle where it doesn't matter if your child's on reserve, every child should get the care that they need, and the governments can decide afterwards who's going to pay for it. But no, there's very much lacking, and in the rural areas too, care is lacking. They don't get not as bad as on First Nation communities, but still it's lacking.
All right. Deb is asking, is there a way to partner and increase the robustness of support to families to allow more participation in life? She says that they're working with other ministries within Alberta, looking at respite and support services for families. She says it's not perfect, but it is moving in the right direction.
Mm-hmm. I think partnering is a key. Like you have a bigger mass, to make some change. So definitely, I think, like you said, I think that's very important.
Juliette is asking, or is commenting, that change will require political will. She says quality of life may not be compelling in a climate of fiscal restraint. We may have to make an economic argument at different levels, municipal, provincial, national. Do we have the lobbying / advocacy skills to do this, do you think?
I'm not sure. I mean, again, I know there are people out there who are trying, but it's getting that voice that is that depending on the government, is that voice important to them? You know, so it's I think it is very much of a struggle.
Chandra's asking, do you have a family support group for this client population? And if so, how did this come about? And do you see a role for such a group?
I don't think one just particular support groups. I think there's different agencies like, you know, cerebral palsy that families can go to. But, you know, it's interesting, in this study, most families did not talk about having any support group or going to any support group.
Yeah,
and it's also just another burden to, you know, having to go to have to go out and go to these support groups. So very few had talked about getting support from, you know, other families with children with similar conditions. Very few. There was no.
Doug, it's Elaine. Just a quick comment on that point, Roberta. I just wanted to make sure that you're aware of the Canadian Family Advisory Network, CFAN.
Okay. I haven't heard of that.
Okay, and again, in fact, I would almost guarantee that there are members of CFAN participating on today's webinar. CFAN represents many parent advisory committees across the country, certainly affiliated with the majority of children's hospitals in Canada and beyond. And I think that for the families in Winnipeg and Manitoba that you serve, as well as for some of our colleagues online providing care and services to other families whose children have complex needs, CFAN might be a wonderful resource to sort of share knowledge, as you referenced a wee while ago in one of your responses. So I just put that out there. You can learn about CFAN right on CAFC's website.
Okay.
They've been a long-standing partner, true partner, and part of the CAFC organization for many, many years now. So I would really encourage you to have a peek. There might be some important resources there.
Thank you.
Allison is asking or commenting that she works in a hospital where many children with special health care needs come for extended periods of time, and she finds that many parents drop their children off with the flu or eating issues or etc. and don't show up until it's time for discharge. And she's wondering if you have any suggestions on the best way to encourage families to be more engaged in their child's care rather than seeing it either as a break for themselves or perhaps them not seeing a role for themselves in their child's care.
Gee, I think that would depend on the family and why they're doing it. And maybe the family doesn't feel that they, you know, feel comfortable or feel like they are allowed to be involved, or maybe it is that it says something though that this is a time that, what does that say, that they get their break? They, you know, that shows how tired, or, you know, and maybe that's a deserving break. I mean, it's, you know, you want them involved, but that could be the only time that they've had where they can go together as a couple and sleep. You know, that's another thing about respite. Quite often, sometimes with respite, the families will use it to do all the errands or whatever, and so they don't really have that time for a break to rest, to get that good sleep.
Joanne is saying that many parents struggle to feel confident that their child will be safe with respite providers due to lack of proper training. Did your study highlight the need for training programs for respite providers? And is the area of respite provider training something that the health system can look at offering for families?
Very much so. Families talk about it. And like one dad said, well, why would you do this job at this low pay? You know, like, again, it's a job that also is not valued. And should be valued, and there should be proper training, and it should be adequate salary as well, because it is a lot of work, and it's, you know, so definitely families talk about it, not having that person who, you know, who is adequate and capable.
Jennifer is saying that in working with many children with complex medical needs, she's noticed that some families are more independent in participating with their children, and there are others that don't seem to have direction where to go, or that participation is even an option. Are there education programs for parents to give them tools that they could use to see how important participation is and how to make it possible when their child is young enough to make a lifelong impact?
I think that's an excellent suggestion. I don't know of any education programs, and that's so true in our study. There were some families who, you know, given everything equal, you have two families, everything equal within the situation. One of them was able to get out to participate more than the other, and and you see that in life regardless. Some people, it's their personality, whatever. But how can we help those who, have everything equal to that next family go out and participate?
All right. Janice is saying, what additional services do you see as being potentially beneficial to better support families to be able to engage in activities as much as they would like?
Again, I think it's everything. I mean, it's our environment. Having accessible sidewalks, places to go to. Families need more support. So I think it's every area. Schools that are understanding. I wouldn't like to say just one particular. It's everything. Every area needs to step it up. We should make. I mean, like our landscapes accessible for like everybody.
Yeah. Dr. Gail Andrew is asking, or she's commenting that similar to Elaine's questions, she says that she would like this presentation to be compulsory for all workers who make decisions for allocation of funds and resources to families. In Alberta, the service is called Family Supports for Children and Youth with Disabilities, and she has the latest document in front of her that is specific to fetal alcohol spectrum disorder. It reads well, but it does not roll out in practice. Families need to justify all requests over and over again, and they may be given funding on paper in a contract, but are unable to find the resources. There are some good projects, such as educating the YMCA to accommodate our children, but this is not available across the province. She has great data that captures what families tell us she's commenting that your research has provided us with great data that captures what families are telling us every day. And we all need to help you disseminate this data, she says. So you've got some strong support from Dr. Andrew at the Glenrose.
That's wonderful, and actually there's so much more from the study. Like this is only one part of it, and it's like trying to get through these interviews and analyze them. Again, we are going to be making a video that deals with how these families deal with participation, and hopefully that will be something that we can also get out with,
Karen is saying that you mentioned that you interviewed not only the parents and siblings, but also the children with complex care. Can you further explain how these interviews were completed with the children?
Yes. Now with these, again, it was only 11 children were able to be interviewed, and the age range really varied. So it depended on the child. It was very open-ended. Some children were able to tell us more than others. And some of the findings were not as detailed, but it was still the same message that the families were saying. The parents, I should say.
Juliet is saying that you brought up the issue of parents saving the system money, which she totally agrees with, but she's asking, are there any studies that have quantified the cost savings?
I can't think of any offhand, but I think some people are working on that. There's a study, I know one study about children with cancer, not so much as what's saving the system, but the cost to these families when their child has cancer. Not only the emotional cost, but the financial cost. I know about that study. So I think people are starting to do work in this area with costing.
As someone who assists in getting families ready for discharge and recognizing limited resources, how can we help or include in their training to assist these families in preparing for life outside, not just their medical needs?
I think one of the big things is getting them to be able to be advocates, like helping them, teaching them how, to ask questions, so that they get answers. So really giving them that training to, how can they advocate for their child. Also, I think somebody when they're discharged, they need somebody with a care coordinator who really knows the system. And you know what, care coordinators, there some are good and some are bad. Some, you know, you luck out if you get one who really can tell you, you know, think ahead, anticipate for you. I mean, not that they're going to solve all your problems, but you know, I think that would be key as well. But also getting your person, your family, to know how to ask questions, to be there to advocate, and not just to sit back.
All right, we do have about another 6 or 8 questions, so hopefully we do schedule 90 minutes to accommodate the discussion, so we have about 10 minutes left. I'm hoping we can get through all of them. But the next is a comment from Lisa Stromquist, who's the national coordinator at CAFC with our communities of practice and complex care and our other guidelines programs. And she says that our community of practice and complex care is involved in the development of a survey tool that will identify the needs of families of children with complex medical needs. The results of the study will help to inform the guidelines that they're trying to create that will be developed, as well as providing evidence to help change policy. And she hopes the community of practice hopes to present strong national voice from all levels of care. So if anyone's interested in being a part of that work, don't hesitate to contact us at CAFC, and we will get you involved with that work. Marley is commenting that as a representative for the Canadian Network for Palliative Care for Children, she was at the Quality of End-of-Life Care Coalition of Canada annual meeting last week and was able to put the unique aspects of parents with children with serious illness forward to the group. They have one of 4 committees focused on caregivers, and the aim is to lobby at the federal level. It included reps from the Canadian Home Care Association, the Canadian Caregiver Association, and one of the actions is to try to make knowledge of existing services readily available for caregivers. So perhaps anyone who's interested in those resources can get in touch with those various organizations and maybe contribute to that work, and maybe we will end up with some resources to help direct parents to these much needed tools and resources. Mm-hmm. Dana's asking, have parents talked about their own participation rather than just the participation in relation to their children as part of this study?
Oh, very much so. Very much so. And sometimes, you know, you have couples where the mother would not be able to participate in everything as much as her husband. Also not being able to participate together as a husband and wife, as a family. Some were able to and some were not. But yes, some of the activities that they used to participate in before their child was born, they're not participating. And that's again because they don't feel comfortable, they don't feel accepted. So the participation was very much similar to what the child was experiencing.
Rita Marie's asking, the many roles that you had listed on that one slide for the parents, fighter, advocate, teacher, etc., was this identified by the parents themselves, or was this through the analysis of the interviews?
That was through the analysis, so that the families would talk about, or having, for example, fighting. We always have to fight, or they would talk about, like always, if they're going into a meeting, they have to act in a certain way, or they would talk about. So it did come from the data. We just labeled it based on, you know, what the data was saying. And you know, these roles, I did present at when I presented this at one of my conferences. One of the people at the presentation said, "Well, I'm a parent. I don't have a child with complex care needs. I do all those roles." Yes, you do. But the thing is, these families do it more intensely, and it's extended parenting. Like it's like your developmental stages. While your child may move on to one developmental stage, but still hasn't mastered those other developmental milestones. So it's intensive. They have to be more of a fighter, and it's also more extensive. So.
Joanne has come back with a follow-up comment when we were talking about the economic impact earlier on, and she's saying it's a very good point about making the case for economic impact, and she's asking, have any studies been done to track and quantify the health/well-being of the parents or families and determine the extent of health care and mental health supports they're accessing? She says parents and families who are not sufficiently supported are guaranteed to require increased health resources, and this would certainly help build a case for policymakers or for advocacy efforts.
I can't think of any offhand. I mean, I've heard through the grapevine somebody is looking at using policy data to see, you know, the changes. But I'm sure more work could be done in that. That would be, you know, really. And then there's work where they show that, you know, families' health needs, maybe not longitudinally, but the health is not good. Sleep is And also another issue is what about the kids in foster care, the families who cannot care for their child because it's just too much for them, you know? So I mean, I think also looking at kids in foster, there's lots of kids in foster care who, you know, with special needs, and their parents weren't able to care for them.
Chandra in Ottawa is saying that as part of their complex care program that they have established in Ottawa back in 2010, they have representation from families on their steering committee and advisory committees. However, they're struggling on how to establish a parent-run or parent group that their families have identified, and their families have identified that group as a need. How best would you suggest they facilitate that?
I guess it really depends on the families participating, and again, this involves extra work for these parents, and time, and you know, even with our family advisory from the research committee, like we were having the family advisory to help us how best to translate this knowledge out there to other families. But these families, to get a group of families together, it's very hard because they're tired, and you know, to get the same families to come to meetings, and you know, they can't get respite.
Yeah. And the last, I think this is more of a comment than a question, but the last thing we have here, and if there's no more get typed in the next few seconds, I think we'll wrap it up right after this. But Melissa in Ottawa is saying that they experience the same barriers there for children in Ontario, whether or not it's due to location, about who is responsible to pay for each type of service. Their children, they often have Inuit children from Baffin Island, are generally adopted to families here in Ottawa and are rarely able to stay with their family in the north. Regionally, she sees differences in support available from different community access centers. For example, 2 young babies on non-invasive ventilation for life support while asleep. One has nursing support 7 nights a week and the parents sleep. The other family only has access to nursing support 1 to 2 nights per week. As for families who may not be able to participate in admission, she often sees financial challenges, the parking and travel, and or babysitting for siblings, etc. And the social work team at CHEO tries to help, but again, are not always available. So.
Yeah. And we do know too, with Indigenous children, they're more in care now than with the residential schools. So.
Doug, I want to make just one quick comment before you close. Roberta and colleagues, I think there's an opportunity under sort of the advocacy we've been talking about and how to connect with government and policymakers and agencies alike. I think because part of your work and research is being supported by the CIHR Institute of Human Development, Child and Youth Health Applied Chairs program. I think there's maybe an advantage. First of all, it recognizes the importance that CIHR as a federal agency is placed on this very important topic and needs. And then I think that when you're ready to disseminate the information, I mean, just the stories, the compelling stories that you've shared with us today, I think you need to target your government audiences. Mm-hmm. Use partner organizations to help you make those inroads. Mm-hmm. Tell the story and tell it over and over and over again. I think, you know, taking the clout, if you will, that is behind this CIHR funded research program, I think may work to your and our collective advantage. So I just wanted to plant that seed for sort of food for thought.
Thank you, Elaine.
So there a couple last comments have come in. Well, I think we can take care of these fairly quickly. Juliette's suggesting, Dr. Woodgate, that you connect with Research Canada to advance your message. And Melissa is saying that, asking, how do families feel about continuity of care between clinicians, prescribers, and therapists, vendors for required equipment, and access to funding for prescribed equipment? She often hears that families is they do not know who to contact for the different aspects of the child's care. So
yes, That's so important. Not knowing, again, you could be the smartest person under the sun, and you know if you haven't experienced something, you're not going to. What do you know to ask? So yeah, and continuity care was very important. What these families spoke about. Very important at schools. The children who have special aids, like this continual changing of the child finally learns to trust that aid, and they have to change. So it's very important.
All right. Well, I think we're going to wrap it up here. That's the end of a very long list of questions. People were certainly interested in the topic and engaged in the conversation for sure. So I would like to thank again the Manitoba Child and Youth Rehabilitation Research Collaborative for joining us and helping coordinate this webinar. Thanks to Christy Whitmire from the Rehab Center for Children Winnipeg for kicking off this partnership with us. And thanks to you, Dr. Woodgate, for such a great presentation that has sparked so much discussion here. And did you have any final comments before we wrap up?
No, I just want to thank you for facilitating this webinar. Very much so.
Oh, certainly our pleasure here, and I think the audience thanks you as well for sure. So as we mentioned, I think at the top, we do record these webinars, and they will be available within a couple days on the CAFC Knowledge Exchange Network at ken.cafc.org. You will receive the registered email addresses here will receive an email with a link to access that as well within a couple days. And if you have any questions, don't hesitate to contact us. We typically do these webinars every Wednesday at 11, maybe not every Wednesday, but most Wednesdays at 11 a.m. Eastern Time. And we hope to see you on the next one. And if you are looking for more information about our webinars, you can go to our website at cafc.org, ciphc.org, and it's under the CAFC Presents section. So hopefully we'll see you at our next webinar. And thanks for coming. Bye, everyone.
Thank you.
Everyone, bye-bye.
The organizer